Hello, my name is Dr. Gabi Kaptur. I'm a heart doctor and a researcher at University College London. The VITAL study is an exciting international research project taking place across several countries in Europe and New Zealand. We are going to be using state-of-the-art technologies, including artificial intelligence, in order to bring together lots of different types of health data. The goal is to create something which is called a virtual human twin. That is a digital version of a person in order to help doctors make better decisions about treatment in the future. At University College London, our part of the study is focused on patients with heart failure who are receiving a pacemaker. We want to understand how patients respond to the pacemaker therapy and whether our digital twin model can help predict who will benefit the most. In the long run, we hope that our research will help doctors personalise treatment in order to make it more accurate, more effective and more affordable. If you decide to take part in our research, you will visit our research clinic 3 times. Once before your pacemaker is fitted and then again at 3 or 6 months after. This video is intended to explain what you are to expect during your first clinic visit, including the checks and measurements that we'll be taking. Thank you so much for considering taking part in the VITAL project. Your participation will help improve the health and care of many people living with heart conditions.
Our research clinic is based at the Bloomsbury Centre for Clinical Phenotyping, located on Cheney's Mews at University College London. When you arrive, you will make your way up to the first floor. You can do this by taking the lift or the stairs. You can then take a seat in our first floor waiting room, where you'll be greeted by one of our research team. A member of the team will then take you to one of our clinic rooms to discuss the visit with you in more detail and answer any questions you may have. You will then be asked to fill in and sign a consent form to confirm you are happy to take part in our study. The first part of the visit will involve our team asking you questions about your medical history, your family's medical history, and we will ask you for a list of any medications you may be taking. We will then ask you to complete a short questionnaire about your physical activity levels and how your heart failure affects your day-to-day activity. We will then move on to some basic physical assessments, similar to the tests performed at a routine GP appointment. We will measure your height, weight, and blood pressure. The next part of the morning will focus on your heart. First, we will perform an ECG. This involves sticky electrodes being placed on your limbs and across your chest to record a trace of your heart rate and rhythm for 10 seconds. We will then look at the electrical activity of the heart in more detail using our ECGI vest technology. The vest has 256 built-in electrodes and is secured by Velcro straps. We will ask you to relax for 5 minutes whilst we take this recording. Following this, we will conduct an echocardiogram. We will attach stickers to your chest to monitor your heart rate and rhythm throughout, and we will ask you to lie down on your left-hand side. A member of the research team will then perform the echocardiogram and take some pictures of your heart using jelly and an ultrasound probe. Next, we will move on to the stepper test. The research team will set up various pieces of equipment for this test, including a heart rate monitor around your chest, a blood pressure cuff on your arm, and a mask on your face to measure the gases you breathe in and out. Once set up, this test will involve stepping on a stepper machine at a pace you can maintain for up to 6 minutes. You may become breathless during the stepper test, and you can stop the test at any point if you feel unable to exercise further. Additionally, we may also ask you to wear a newly developed heart monitor to measure your heart rate throughout the different tests on your visit. After this, you will have an MRI scan of your heart. The research team will help to prepare you for your scan. This will involve fitting ECG stickers and ECGI vest markers, as well as fitting a cannula and collecting blood and urine samples. The MRI scan takes place on the ground floor of the building and uses a powerful magnet and radio waves to form pictures of your heart. You'll be asked to lie down on a flat scanning bed that slides into a tunnel while those pictures are taken. You'll be given headphones to wear during the scan. These will reduce the noises you hear from the scanner and also allow the person operating the scanner to talk to you throughout your test. During the scan, you'll be given an injection of a contrast agent that will help to visualise your heart. After the MRI is complete, you will have finished your first visit of the vital study. We will then be in contact at a later date to arrange your 3-month visit and 6-month visit. These visits are much shorter and only include some of the measurements described in this video. Thank you so much for taking the time to watch this video. Your consideration to take part in our study is greatly appreciated.